CNA Practice Test 2026 NEW 40 Infection Control Updated Questions and Answers. Question 1. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 2. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 3. What is the best way to prevent the spread of infection? Wearing gloves, wearing a mask, hand washing, using antibiotics. Hand washing is the #1 way to prevent infection spread. Question 4. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 5. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 6. How should you identify a resident? Ask their roommate, check their room number, check their ID band, call them by name. ID band is the standard identifier. Question 7. A resident wants to complain about care. You should tell them to be quiet, inform the nurse or ombudsman, ignore them, tell them they are wrong. Residents have a right to voice grievances. Question 8. Which position is best for resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's upright aids lung expansion. Question 9. The normal adult pulse rate is 40-60 bpm, 60-100 bpm, 100-120 bpm, 50-90 bpm. 60-100 bpm is the normal range. Question 10. How often should a resident be repositioned? Every 4 hours, once a shift, every 2 hours, once a day. Standard is every 2 hours to prevent pressure sores. Question 11. What is the first step when discovering a fire? Rescue residents, activate alarm, contain fire, extinguish. Race protocol starts with rescue. Question 12. A resident is angry and shouting. You should shout back, leave the room, stay calm and listen, call security immediately. Therapeutic communication involves staying calm. Question 13. What is a living will? A bank account, legal document about end-of-life care, a birth certificate, a list of belongings. Advance directive for medical wishes. Question 14. A resident is choking and cannot speak. What should you do? Wait for help, perform abdominal thrusts, offer water, hit their back. Abdominal thrusts Heimlich for complete obstruction. Question 15. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 16. When a resident is on NTO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPO means nothing by mouth. Question 17. A resident falls. What is your first action? Help them up. Call for a nurse. Move them to bed. Give them water. The nurse must assess for injury before moving the resident. Question 18. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap, below the bladder to prevent backflow/infection. Question 19. When dressing a resident with weakness on one side, dress weak side first, dress strong side first, dress both at once. It doesn't matter. Dress weak DW and dress strong. Question 20. A resident is in isolation. What is done with their linens? Double bag them, wash in the sink, throw them away, shake them out. Double bagging or special handling per facility policy.